along with our fearless Executive Director of the Alliance, Nancy Wolanski. We'll be joined by Nina Harrison and Alan Krinsky of the Economic Progress Institute. As a policy director, Nina Harrison supervises the policy team, leads coalition building and community engagement efforts, and cultivates relationships with policymakers. Prior to joining EPI, she served as a racial justice fellow and staff attorney for the Community Legal Aid in Worcester, Mass., where she represented clients with sealing and expungement of criminal records and appealed criminal records-based denials of applications for subsidized housing. She will be joined by Alan Krinsky, the Director of Research and Fiscal Policy. He's responsible for the supervision of research, data, and major reports, and his policy portfolio includes the state budget, revenue, taxation, economic development, wages, and predatory lending. So without further ado, thank you for joining us today, and I'll let you take it away from here.
Great. Thank you, Robin. Thank you all for making time in your really busy schedules. We've started doing these policy briefings every other week because there's so much going on that we want to make sure that you are up to date on what we know as soon as we know it. A lot of the things that we have been talking about are on the federal level, but there's also a lot going on the state level that will impact your work. And so we want to make sure that we have time for both of them. We invited Alan and Nina today to talk some about the budget, both the state budget and the federal budget. And we'll have time for questions for them. They also are going to talk a little bit about some of the policy issues that they are working on at the State House this session of the General Assembly. And is Nina on? I'm not sure. I can see her, but Nina, direct message me if you're on, and I will spotlight you as well. But we will start with Alan. We will take some time to focus on the work that the Economic Progress Institute is doing, and then at the end, I'll have additional updates on both the federal and state level on some other policy issues. So thank you so much, Alan, and Nina, if you're on, and I will turn it over to you. Feel free to share your screen, and you can get started.
Okay, thank you, Nancy, and thank you everyone for joining us today. Y'all can hear me and see my slides? Great. Okay, so I just want to talk a little bit about the, here we go, about the budget cycle, the budget gap, some proposals from the governor's proposed budget, and some options for narrowing the gap. And so we'll just go through there. So the budget cycle is really a year-long or 11-month, year-long cycle that starts, as many probably know, in the summer and fall, with agencies putting in their budget requests. There's conferences called caseload and revenue estimating, which give policymakers a sense of what the economic trends are and what money they have to work with in the budget. And the governor submitted his proposed budget in January, and now finance committees are holding hearings, and there's opportunities for folks to testify on specific parts of the budget, other legislation around the budget and other legislation not around the budget. We have a document, we'll try to share the link to this later, of at EPI, our summary of many items in the budget. It's not comprehensive, but shares a bunch of items we wanted to highlight, and I'll share a few of those today. So the general context for the state budget situation is that the years of federal pandemic assistance are winding down. The last of those dollars are being spent in the current fiscal year, which is fiscal year 2025 that ends June 30th. And there may be a little bit left over for next year, but mostly done this year. Nina will address this after I'm done, but there is a real possibility, even likelihood, of decreased federal assistance going forward, given what we've heard, and that includes something like the enhanced assistance for healthcare expiring, and potential Medicaid and SNAP cuts. A few months ago, the Rhode Island Office of Management and Budget predicted almost a $400 million budget gap for next year. Those have been revised down more in the 200 to 300 or so million range. The governor in the proposed budget estimated that at a 223.3 million gap. And this slide is there, not my slide, it's there from their presentation, the governor office, of how they propose to close that gap. And I'll just summarize that here quickly. So a big chunk is from reversing what's called supplemental contributions. It's a little technical, but when there's a budget surplus, that money is supposed to go into a rainy day fund and also into the employee pension fund. And so because of some issues with tax year 23, there's a lot more than they expected. And so by law, those will go into the supplementary rainy day fund and the pension fund. The governor's proposing reversing that and just putting that into the general budget for next year. For restricted receipts accounts, there's sort of special accounts for different policy issues or different policy areas or programs in the government. Generally, 10% is taken out of that for the general fund to cover their operation. Governor's proposing increasing that takeout to 15%, which means less for those programs that were targeted. In terms of additional revenue, one of the proposals for a digital advertising tax that could raise almost 10 million. However, that's only been implemented or started to be implemented in one state so far, Maryland, and that's in the courts right now. So that's sort of an uncertain future for that. And then there's $125 million in what they call net expenditure changes. The administration claims that the proposed budget has no cuts to critical services, but we really don't know what's included in that 125 million. It would seem to be lots of small things added up together, some with increases, some with decreases, but there's no sort of list anywhere of what makes up that 125 million. It's not that we've been able to find. And so maybe folks, including perhaps people here who have more specific expert knowledge of specific programs to help identify where those $125 million in savings are coming from and how it can possibly be done without cuts to critical services. We do know that the budget underfunds RIPTA by $32.6 million as of now. So that could be, I'm not even sure if that counts as part of the 125 million, but that's one big thing that I think we see as a critical service that is not being covered by the budget. And there are even say smaller things like security for housing for the elderly program would be canceled by the budgets. It's not a huge amount of money in terms of a several billion-dollar budget, but that's an example of something that one might consider a critical service that is not included. This just talks about the overall budget numbers, but what I really want to emphasize here, and this is something that maybe Nina will talk about or her comments might relate to better, is that this chart here shows that this is the average for all states, that on average all states, 34% of their state budget is from federal funds. On the right, you see for Rhode Island, it's almost 36%, which means we're more than on average for other states reliant on federal funds, which means if indeed there are federal cuts to assistance to states, then that's going to be all the more harder for Rhode Island to respond to and to make up for, since we have a higher reliance on the federal funds. And there have been some shifting over the last 2 decades for things like Rhode Island Works or child care assistance, where we've cut or in some cases eliminated state funding and relied entirely on federal funding for some of those programs. I'm going to skip over most of this. This just talks about some of the different things we have in the document. The summary of the budget includes for the food bank having less than in the fiscal 25 budget. And there's some healthcare items here, sort of attempts to either freeze rate increases or make it an every other year thing instead of an annual inflation increase for some of the rates. That's part of the budget proposal. So minority entrepreneurship, the budget includes level funding of $140,000 for urban ventures. And so that's sort of an interesting kind of thing to note is when we see level funding of something, it means you're getting the same amount of money, but because of inflation, it's probably worth less money than before. So it's not buying as much. So even without a cut, you can see a loss of services. And we sort of see this with the funding of cities and towns, where the pilot program where the state reimburses localities when they can't tax nonprofits like hospitals and universities, that kind of money is below what it's supposed to be. Aid to distressed communities hasn't increased since 2017. The governor's proposing freezing the car tax, phase out reimbursement to local governments so that doesn't increase each year with an inflation type adjustment. So sort of a lot of kinds of things are not necessarily cuts, but are flat, and so could result in a loss of services. I already mentioned the RIPTA budget situation. And so at EPI, we're trying to look at the budget as a whole and what it's doing, not just at individual policies or programs. And does it include, is it as a whole funding sort of opportunity and helping those with the fewest resources? In many cases, people served by nonprofit organizations. And so we'll note there's no new proposals or increased funding for a number of things, including cash assistance, Head Start, childcare assistance, the state earned tax credit or the minimum wage, a number of things that in a holistic approach to the budget, we might like to see improvements in these sorts of things. And we say, despite the budget difficulties, we would say that austerity spending approach is not a great idea. It will create a cycle that hurts the economy. And one alternative is we're supporters of a proposal to have a 3% surtax on income for the top 1%. That cut off $625,000 approximately. That could generate $190 million annually based on the estimates we have. So targeted proposal to increase revenue that could help prevent, especially given what I said earlier about some uncertainty in the proposed budget's effort to close the budget gap. This kind of thing could help with that and going forward. And would also increase tax fairness at the same time. And we already know that, say, the top 1% pay less of their income as a percentage in total state and local taxes than say the lowest 20%, 8.6% versus 13.3%. So it would increase tax fairness and could be a partial solution to some of the budget problems that face the state. So there are opportunities I mentioned earlier for folks to weigh in with written or verbal testimony, and we'll be getting more information as the session goes on about what's available in terms of revenue for the final budget that will be negotiated and approved in June. So that's what I have. I'll turn it over to Nina to talk a little bit more about the federal landscape and some of our other policy priorities.
Thank you, Alan, and thank you everyone for having me. My name is Nina Harrison. I am the Policy Director at the Economic Progress Institute, and I'm going to be talking to you a little bit about some of the federal threats that we are facing, which I'm sure many of us have been plagued by and overwhelmed by in recent times. So, as many of you know, in Congress, they've been going through the budget resolution process, and the House has passed a resolution. I'm sorry, I'd like to share my screen. All right.
You should be able to. I made you a co-host, so you should be able to.
Right. I don't have an extensive presentation, but I do have some numbers that I want up there for people to be able to see. Oh, I see. Here we go. All right, so the House resolution was passed in the House and it proposed $880 billion in cuts to Medicaid over 10 years. I did put some additional, more specific information that essentially the resolution instructs the Energy and Commerce Committee to propose changes in spending that would lower outlays by $880 billion. And that because the president is insisting that Medicare will not be cut, we have to assume that those cuts will come from Medicaid. And Medicaid serves more than 80 million people in the United States and more than 300,000 in Rhode Island. So those cuts would be significant. Approximately half of Rhode Island children get their health insurance through Medicaid. And many elderly, low-income, and disabled Rhode Islanders rely on Medicaid for their coverage as well. The Senate still has to approve and vote on this, and the numbers are the margins are slim, so that will happen this week. The appropriations deadline is March 14th. And so they'll have to vote to see if they're going to extend the funding temporarily or a continuing resolution through September 30th. They're also proposing $230 billion in cuts to SNAP over the next 10 years, or $23 billion per year, which would be a 25% cut across the board. And in Rhode Island, we have approximately 140,000 people on SNAP right now. So again, as Alan said, with the budget deficit that the state is facing, without additional revenue or some substantial changes to the way that Rhode Island currently funds these programs, the writing on the wall would mean that Medicaid benefits would have to be cut, SNAP benefits would have to be cut, unless the state could come up with revenue sufficient to replace that federal funding, which would be a very steep hurdle to overcome. EPI does have a proposal about revenue, but a little bit more about this. Some of the other proposals as ways to cut money to Medicaid include work requirements, increasing work requirements for Medicaid and SNAP in ways that it doesn't seem experts believe would actually result in much money being saved, but would in fact prevent people from using those benefits and make it more difficult for them to access. And so I'm going to stop sharing so we can discuss. Oops. But essentially, we're facing more than 100 billion in combined cuts to Medicaid and SNAP over the next 10 years. And the differences in that funding will either result in people losing those benefits or in states having to make up that cost. And Rhode Island is already more reliant on federal funding for a percentage of our overall state budget than many other states are. And so I think we may be especially vulnerable to these kinds of cuts. In addition to that, we also have the expiration this year of premium enhanced tax credits for the Affordable Care Act. And so this is something that is not a part of the budget resolution process, but is an important part of the federal landscape to be aware of. And that's during COVID, they passed they extended funding for premium enhanced tax credits to make sure that people could afford health coverage during the pandemic. And those are people who wouldn't normally qualify for Medicaid, but were just over the Medicaid limit, so still very low income or moderate income. And what the federal government did was create enhanced subsidies to help people afford that coverage. Those subsidies are set to expire this year. And if we're assuming right now that the federal government is not going to extend those subsidies, the effect of that is going to be that approximately 46,000 Rhode Islanders who get their health coverage through Health Source RI are going to see their premiums increase by an average of 85%. And some, the lower income and higher income, will see their premiums increase by maybe more like 200%. So what this will effectively do is make it so that these people who are probably already struggling to meet their basic needs may have to drop their health coverage and or select a less comprehensive plan and ultimately probably forego care and having to make choices between rent, groceries, and health coverage. So I will speak a little bit about some of EPI's priorities that aim to address some of these issues. First is the Revenue for Rhode Islanders bill. Revenue for Rhode Islanders is a coalition focused on raising revenue for Rhode Island. And as I mentioned, we need revenue now to protect Rhode Islanders from potential Medicaid and SNAP cuts, and also to deal with the state budget deficit that Alan mentioned. And so that proposal is to tax the top 1% of income earners on a surtax only on income above $625,000 per year. So it's very narrowly applied. It would raise $190 million in revenue for Rhode Island that we would suggest be invested in things like critical benefits like Medicaid, SNAP. And we also know that we have bridges falling down and other things, and public education and RIPTA that require funding, and childcare and services for seniors. So we're really hoping that that bill, that we're uniquely positioned to get it passed this year between the federal and state threats to critical services. That's being sponsored by Senator Murray and Rep. Alzate, and we hope that you will all support it. We will have a sign-on letter calling for organizations to sign on in support of this legislation, and I'd be happy to share that with you all after in a Google form for you to sign on and support. We also have a piece of legislation designed to address those expiring tax credits for the Affordable Care Act, which I described. And that is essentially, after EPI participating in a work group with Health Source RI and other stakeholders, we came up with a plan. The work group came up with a plan to replace those federal subsidies by creating a state subsidy that would replace them entirely, so that nobody would have to lose that coverage or see their premiums increase so sharply. And we propose to pay for that by essentially a 1% assessment on health insurance companies across the board. And so if that would not have an effect on general revenue, it would have a very small effect on health insurance companies, and that would help protect those 46,000 Rhode Islanders who get their coverage through Health Source RI. Another priority of EPI's is to stop payday lending in Rhode Island, which is a predatory lending practice that drains $3 million every year in fees from Rhode Islanders, mostly low-income Rhode Islanders, and we know that payday lenders specifically target Black and Brown communities. And so at a time when financial constraints are such that they are, we don't need $3 million in fees and fines from low-income Rhode Islanders mostly leaving the state and leaving the Rhode Island economy. And we are the only state in New England that allows this practice at the percentage rates that we allow here. And payday lenders are the only lenders in Rhode Island allowed to charge upwards of 260% APR. So we are hoping to end that practice this year. The House sponsor is Rep. Alzate. And this is a fight we've been fighting for some time. I could go on and on about our priorities. We're fighting for more affordable childcare through the CCAP program. We're fighting for Medicaid defense, to make sure that the state knows that people here care about Medicaid and rely on it, and it would mostly harm children, Rhode Island's children, approximately half of them who receive benefits through Medicaid. We're also championing equity legislation because we also know that there are federal attacks on DEI and even the word and notion of equity. But here in Rhode Island and at EPI, we don't want to back down from championing equity. And so we are promoting with the Equity Impact Campaign legislation that would be a pilot program allowing for up to 20 bills to have equity impact statements written about them, which would essentially be like a tool, like a fiscal note, that would help legislators and constituents be able to analyze and understand a bill in terms of who it would impact and how, to make sure that all of Rhode Island's communities, the disabled, religious, non-religious, Black, Latino, historically discriminated, LGBTQ+, the immigrant community, to make sure that no communities would have any unintended harmful consequences, and that to the extent possible, and whenever possible, that legislation can be crafted in ways that would reduce historic and present disparities. And so that Equity Impact Campaign is something that we've been working on for a few years. It has a lot of momentum behind it, and we're really proud to be trying to keep equity alive and the fight for equity alive in Rhode Island. So I'll pause there, but happy to go on and on about our policies, and happy to connect with anybody else who would like to talk more about any of those issues.
Would love to just give a couple minutes for questions. If you have questions for Alan or for Nina, or just about general work that the Economic Progress Institute is doing, you can feel free to come off mute. I don't see any questions in the chat, but does anyone have questions for Alan or Nina? Maybe you just did such a thorough job that no one has any questions. One question was in the chat is if we could share out the slides afterwards. So Alan, if you don't mind sending me an email with those, we are happy to share those out. I did want to mention that in the document that Robin posted in the chat, that is our kind of go-to document for this policy briefing, I did include information about the payday lending hearing that is happening tomorrow, correct? It is tomorrow, Alan? Yes.
It's tomorrow. And if anyone has specific questions, I'm sort of our point person on payday and predatory lending, so I'm happy to answer those.
So they would love to have testimony, both written and in person. So we all know that payday lending is a discriminatory practice and also a really devastating practice for our families who have low income and are preyed upon by these lenders. So we'd love to have folks get involved in that. So in the document, you'll see a link to the hearing agenda, a link to the bill, as well as the email to send any written testimony to. I just copied it from your email, Alan. So the information that is in the document is from EPI, but they will be doing the hearing tomorrow, 4:30, 5 o'clock. And so if you're able to go in person and to speak, I'm sure they would appreciate that.
I just wanted to add, even if you can't be there in person, which we would love, and even if you can't submit written testimony, which we would love, you can still call your state rep or senator, or you could call the speaker or Senate president. I think letting your state reps and senators know that this is important to you, even if they're not on the committee, is kind of a part of building pressure that we need. So especially if you could call leadership or call your state rep, we would really appreciate that and let them know that you want payday lending, predatory payday lending to stop in Rhode Island.
And also just a reminder about advocacy from a nonprofit perspective. Nonprofits are allowed to advocate for legislation. Sometimes people say, okay, we're a 501c3, we don't lose our 501c3, we can't advocate for legislation. It is perfectly legal for nonprofits to weigh in on legislation. You cannot endorse a candidate or oppose a candidate for office, but you can weigh in about legislation. If for some reason you're not in a position to represent your organization, remember you are an individual Rhode Islander who has the right to weigh in about legislation just as a personal resident. And so that the one thing, if you are doing it as a resident, just make sure that you state where you live, because people want to know that for what district you're in. But you can find that out by going to the Secretary of State's website. So please know that your voice is really important, and it's really important to weigh in on these things. We are going to be doing a advocacy campaign, hopefully starting next week, focused on encouraging legislators across the General Assembly to protect social services as they are developing the FY26 budget. They are going to be looking for places to cut, and we want to make sure that they preserve important services for our communities. So we will be sending out information about that, but for that, we are looking to blanket the entire General Assembly with those messages. And so we will be giving additional information about that. But there is the specific bill that Economic Progress Institute is championing on the raising revenue through the tax on the top 1%. The link to the Raising Revenue Coalition is in the document, so that you can also go there and sign up. I'm assuming you have a sign up for the new newsletter there that you can follow up with. I will also make sure, we will also add Nina and Alan's emails into the document so that you can reach out to them if you have follow-up questions or would like to partner with them moving forward. So any other questions for Nina and Alan? Thank you so much. This is really helpful. You're welcome to stay on or hop off, whatever works with your schedule. But thank you very much for sharing that. We're happy to partner with EPI as we're looking at this legislative challenges that we're facing. So thank you. I am going to give some other updates for you. We'll start on the state level. We had a couple of bills come up on the state level last week that were scheduled for hearings, and the one was House Bill 5562, which would increase the state audit threshold. Right now, nonprofits that have a revenue of $500,000 or more are required to submit a audit when they do their yearly registration for charitable fundraising. We are asking that they increase that level to $1 million, recognizing that there are not enough accountants in the state to be able to provide audits on a regular basis for smaller nonprofits, as well as just the cost on a $500,000 budget to pay $10,000 or $20,000 for an audit is really can be prohibitive. So we had a hearing this past week in the House Committee on State Government and Elections, which went very well. They didn't vote, they have not voted on it yet, but we got really positive feedback on it. We are waiting for a bill number for the Senate companion bill, and when they're going to have a hearing on that. But if you are interested, if you fall into the $400,000 to $1 million revenue space and would like to be involved in advocacy, please let us know. There was another bill that came up in the House as well. It was Bill 5454, which was a nonprofit disclosure bill. It would have required nonprofits to post on their website and submit to the General Assembly a list of the 10 highest paid salaries, as well as what benefits were being provided to those individuals. as well as all sources of organizational revenue. Most of that information is already available through 990s. So our stance on the bill was that it's already available, but that we would really like the committee to focus on low salaries in the sector and how we can increase reimbursement rates and state contracts to ensure livable wages for nonprofit staff. That bill was actually pulled by the sponsor before the hearing, so there's no companion bill in the Senate at the moment. So at this point, it is a stalled effort, but we will let you know if it comes back up again. And then the other state level issues are on the document that Nina and Alan are working on. As the last thing is that we sent a letter to the governor and the head of Department of Administration asking them that in light of all the issues happening on the federal and state level, we requested expedited contracting and reimbursement. I have met with the director of purchasing. I've met with the Office of Grants Management. They are looking into the feasibility of that, but it would really help if you are having issues with your state contracts or grant reimbursement. If you could let me know, then that would also help us to give examples or just to better understand where the pain points are. So if you can let me know about that, that's a work in progress. So that is kind of where things stand on the state level right now. At the federal level, as Nina said, the federal budget continuing resolution was passed by the House yesterday, and it does need Senate approval. But I just wanted to note a couple things about the continuing resolution that was passed. One is that it does not include congressionally directed spending, which is what we call earmarks. So if you received an earmark through the FY25 process, that is not included in the CR that just passed in the House. So it is unclear whether there's any opportunity to get something re-added into the CR or into the budget, but just wanted to make you aware of that because the new congressional directed spending applications are open right now for about another week. And so if you feel the need to resubmit or reapply for the thing you requested in FY25, you might want to just keep that in mind as you are looking at what you're applying for this next year. If the continuing resolution passes the Senate, this essentially means that the fiscal year 25 budget will in effect just have been a continuation of the FY24 budget. They will not create a new budget. It will just be these continuing resolutions going until the beginning of the next fiscal year, which essentially resets the fiscal year 26 budget process to be starting now. So if they pass the current continuing resolution, that essentially takes care of any budgeting questions for the current year. And then they will be starting the FY26 budget process. So the earmark applications are for FY26 that are open right now. Those links are in the document, the briefing document, so that you can go there. One thing to keep in mind is that not all, essentially what happens when you get an earmark is that it gets approved, but then you have to go through an agency process. So if your program for workforce development gets approved, you still have to submit a grant application to the Department of Labor or whatever department it is that you are going to receive the funding for. It is unclear as to which departments, which agencies are going to have funding open and available for earmarks for FY26. Usually what happens is that the congressional offices make assumptions based on what happened the year before. You need to make sure you're aligning your grant proposal with agencies that are expected to have funding for earmarks in the upcoming year. So that is just one thing to look at. You can see what agencies had funding available in the previous year, and then you can use that to direct your application. There are fewer agencies available for nonprofits to apply through on the House side than there have been on the Senate side. Now that the Senate is also run by Republicans, it's unclear if they will make similar restrictions, but in the past, the Senate has had more opportunities and broader opportunities for funding streams than the House has for nonprofits. So what you will see in the applications are what was available last year, and they're essentially assuming that those will be the areas available again this year. But especially as you're dealing with lots of questions about funding, I encourage you to look into those programs and see if there's something that you would like to apply for FY26. It is not guaranteed, but if there's something that is important to you, it's worth doing an application. The application that goes through the congressional offices is a simplified version. It is not the complex federal application that will come later if you're approved. It is a simplified application. So that is just in terms of the CR. The other thing that the CR includes provisions essentially to allow, well, it doesn't include provisions to prevent the president from continuing kind of the DOGE efforts to pull back funding. So there's nothing in there that says, in addition to what is already law, there's a penalty for the president to pull back money that Congress appointed. It also says that that Congress cannot do anything about the president's tariffs. So we're seeing a lot of back and forth right now on questions about tariffs, and the current CR includes a rule in there that says that Congress can't debate the president's tariffs. So that is just something else that is included in that. Also on the federal level, we are continuing to see executive orders be released that affect nonprofits. The National Council of Nonprofits has its tracking document that is kept updated, so that link is on the sheet, but know that it is continuing to be updated because there are continued executive orders being released. One that just came out is related to the Public Service Loan Forgiveness Program. So that is a student loan program that provides some level of forgiveness for your student loans after you have worked in the for the public good for a certain number of amount of time. The new executive order directs the Secretary of Education to ensure that the definition of public service excludes organizations who, quote, advance illegal immigration, terrorism, discrimination, and violent protests. Those things are not defined, and we have seen in a lot of the DEI executive orders a lack of definition, which could be interpreted broadly by the administration. And so we're concerned about this because most nonprofits do not ask the immigration status of the folks that they're serving. So if your organization happens to serve someone who it does not have documentation, does that mean that disqualifies you from getting your student loan forgiven? We would not want to see that. It also includes child abuse, which we are assuming is a reference to issues around trans young people. And so we also don't want to see folks who work at organizations that support trans youth lose access to public service loan forgiveness because of that work. So we are keeping this on our radar. It cannot be implemented without a rulemaking process, which means the public can weigh in on this. So we will keep you posted about that. But we've seen kind of circumventing traditional rules and guidelines on how things are implemented with other executive actions. So just want to keep that on your radar. In terms of litigation, the National Council of Nonprofits, they had filed a lawsuit in DC to stop the federal funding freeze. They got a preliminary injunction. There was a question in that lawsuit about what is an open, quote unquote, open grant or contract. They've submitted a motion to ask the judge to rule on that because they want to make sure that organizations that have grants that have been awarded but not yet dispersed are included in the freeze. So there was a question by the government of, well, if this ruling only applied to grants where money has already been dispersed, but not to grants that hadn't yet been dispersed. So they're allowed to cancel ones that hadn't yet been dispersed. So National Council of Nonprofits has asked the judge to rule on that to make sure that those grants are also included in the injunction. The state attorneys general case, which was brought in Rhode Island by the Rhode Island Attorney General and other attorney generals, continues to get the support of the judge, and it is continuing to be appealed. It probably will end up at the Supreme Court, but that one is continuing in litigation. The one thing to know is that both of these cases are about the OMB memo that did the funding freeze. There was some funding that was frozen before the OMB memo, and that has not been covered by these lawsuits. So National Council of Nonprofits and some other organizations are considering whether they need to, how they can go about getting those additional early freezes included into litigation, because we don't want those organizations to miss out on that. But it is really important, if you are having issues about your federal funding, if you could let us know. We're working really closely with the Attorney General's office and with National Council of Nonprofits and the congressional delegation, trying to push on all angles to make sure that nonprofits are getting the support that they need, as well as helping in the appeals process. We're starting some legal supports if you need to appeal the termination of a grant. So if you can please let us know, with the appeals process, you have 30 days after you get a termination notice. So it's important to quickly turn that around, and so we want to connect you with legal resources if you need them. So please let us know if you have received a termination notice. There is also a preliminary injunction about DEI, so that the administration, according to the injunction, the administration may not pause, freeze, impede, block, cancel, or terminate obligations or awards under current contracts or change the terms of contracts because of DEI programming at the grantee's organization. They are also not allowed to require certification by an organization about their DEI program. We know that Rhode Island organizations have received certification requests. And so basically saying we're certifying that we're aligned with the government's DEI priorities. That is no longer allowed under the injunction. So it is being appealed, but the injunction is still in force. And so if you get a certification request now, please let us know, because that is going against the injunction. And you also should not get any sort of enforcement action based on an allegedly illegal DEI program. So please let us know if you are getting any of those things so that we can help with those. We have several things coming up that may be helpful to you. There's a federal grants session tomorrow that is done by a law firm in DC. That is on the list. We have advocacy office hours tomorrow with Rachel Flum. So if you are concerned about your part of the state budget, please take that time to connect with Rachel. EPI, together with the Rhode Island Food Bank, is having a session on Friday with the congressional delegation about the impact of the potential federal cuts on things like SNAP and Medicaid. So the link to register for that is in the document. National Council of Nonprofits is having a session next week on the legal landscape and path ahead for nonprofits and philanthropy. The link to that, you can register either for the live session or to get the recording. And Nonprofit Vote has a session next week on the SAVE Act, which is the voter registration law that we are opposed to. It would require citizenship documentation in order to register to vote, and you need to do it in person, which would eliminate voter registration drives that nonprofits do. Many people do not have access to their documentation, their citizenship documentation, or transportation to go get their citizenship documentation. So it would impede people's ability to vote. So there's a session on that next week. We also are having a session with Rhode Island State Council of the Arts to talk about budgetary issues in the arts next Friday. In April, we'll be having a session with the Office of Management and Budget Director, Brian Daniels, to talk about the state budget on April 16th. So you can save the date for that. And we have our regular programming. We have our fundraising learning session next week, options for employee health coverage next week. All of those are at the bottom of the document. So we have a whole 5 minutes if you have any questions. I know that was a lot of content. I know some people have had to hop off, but just wanted to see if anyone has any questions.
Nancy, can I ask a question?
Yep.
And it's regarding the the congressional monies.
Yep.
So, and this is, you know, I apologize if this is too personal for my agency, but too individual, but we got money this past, so 25, fiscal year 25. Yeah. Is there any, and my understanding from our CFO is it's already been obligated, but I'm wondering if that is still, because you're the second person who said to me that there's some potential risk there still. If it's not like in our bank.
So yeah, so our understanding is that if it is not in the CR and the CR passes, unless there is an extraordinary, like another mechanism, it's not included in, because United Way is in a similar situation that there's something that was approved and, but if it's not included in the congressional budget, then.
Okay, thank you. Just one clarification.
Other questions? Oh, the last thing is just 401 Gives is coming up in just a couple of weeks. And we are behind registration. I know people are just focused on what is right in front of them. So if you could help us get the word out that 401 Gives is happening, it's 36 hours again this year. So it'll start at 6 a.m. on April 1st, and then we'll go to 6 p.m. on April 2nd. We, because of everything going on for nonprofits, we are keeping the early bird registration through the whole registration period of $35. You can register up until March 21st. So if you have not yet registered, please register. And I think that that's it.